Welcome, everyone, to A Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM KPPP-LP Fargo Moorhead, where we are adding local color to your airwaves. And we are also on social media. You can follow us at lots of different places. But we're glad that you're joining us here, whether you are on terrestrial radio or on social media. You can join the conversation today. I will be talking about the pandemic problems, not just those faced here locally, but what we are facing as a country. These are very trying times. It is hit and miss. This is unprecedented. We have never experienced anything like this before. And so as this pandemic progresses, we are learning new things about the virus. We are learning new things about our country. We are learning about how a crisis can be politicized, can be taken out of context, can be used to misinform the public, scare the public, hurt our economy, and all sorts of things. We've learned about the impacts on our healthcare system and just how fragile it really is. And so is the rest of our economy. So we have to grapple with all of these things, and there really isn't a roadmap for how to do it. You all have no idea with how many people and my friends and my family that have reached out to just talk things through and say, hey, I'm seeing this. What are you seeing? How do you feel about this? Sending me articles, videos. By the way, I do try to watch the stuff that you guys send me. And if I haven't had a chance to talk about it with you, it's probably because either my box is full, I have so much stuff to go through, I haven't gotten to it yet, or also it could be because I need to do further research. One of the things that I have really learned in this field is that you don't want to jump the gun. You want to make sure that you are looking at all of the available information, do your research, do some digging, investigating, find out everything that you can before you speak, before you give your opinion. Obviously, it's not very ideal during the time of a pandemic because people want information quickly, but sometimes bad information is better to be kept to yourself. It's better to not give out information that you're not sure about until you know more, because that could, at these times, these trying times, that could be very damaging. But with all that said, I give a heartfelt thank you, send a heartfelt thank you to everyone who takes the time to send me all of that information. And I apologize if I haven't been able to respond to either your phone calls or your messages or your comments. I try to get back to people. I can't always get back to every single individual, but I do appreciate and I do see the things that you are all sending me. So thank you very much. How can folks follow us and support our work, dude?
Well, they can go several places. If you're driving around Fargo Moorhead community in your car, and you just have to go out 7 o'clock every night to hear Mexican Crossing Lines, I think that's great. Mm-hmm. Give us a call and let us know you're doing that. That's 701-566-0917. It's a message line, basically. You can leave a message up to 3 minutes. 701-566-0917. If you want to send us an old-fashioned email, you can send Cindy an email at cindy@kpppfm.com or me, Duke, at kpppfm.com. You can, if you're watching on Facebook, just check out our social media pages on Facebook, 88.1 FM Fargo Moorhead, the People's Press Project, Mexi-Can. Jump over to YouTube, Duke 1517. We're streaming on there right now. Duke 1517. It's actually Duke Gomez-Schempp, but if you type in Duke 1517, it goes right to the channel. And also go to kpppfm.com and have a look around our website to read more about our history and different programming we do here in the Red River Valley, Fargo Moorhead, West Fargo, and Dilworth. And also when you're when you're there at the website, go to the donate tab, make a tax-deductible donation to our station because we're a nonprofit and we rely on listeners and viewers like you. And thank you.
Thank you indeed. Let's get to our numbers for today. First of all, I want to share with you that, we're going to skip that.
Right.
Our world numbers, of course, are now at 3,742,665, with the United States, global deaths, at 262,709. In the U.S., we currently have 1,256,639 cases of coronavirus, 74,121 deaths, and 205,268 people recovered. On my states counts, I am not seeing the new number of cases for the state of New York, for example, or Virginia, or Colorado, or Washington, or Nebraska, or New Mexico, or New Hampshire, or Idaho, and I can't tell you why.
Yeah.
I also don't have new deaths for many of these states, including Virginia, Colorado, Washington, Nebraska. So I don't know if this is, again, a delay in the reporting or what the deal is. What I can tell you is that we do have hundreds of new deaths still happening in states like Illinois, Massachusetts, New Jersey, Pennsylvania, etc. And I want to know how we're doing in Minnesota and North Dakota.
Well, not good in either place. We had an additional 617 confirmed cases in the past day, bringing the total in Minnesota 7,234 confirmed cases of COVID, 428 deaths, and there was 27 people who died in the past day in Minnesota. In Clay County, where we live, 169 confirmed, 13 deaths. We haven't had anyone die for a few days, but our numbers go up by 10, 20, 30, 40. Now in Fargo, it's really bad news, really bad news. There were 1, 2, 3, 4, 5, 6 people who died in Fargo yesterday. Actually 5, one was in Grand Forks County. But
Okay.
they're all, it's 90s, a woman in her 90s, a man in his 90s, a man in his 90s, a woman in her hundreds, and a man in his 50s. All died, and then a woman in her 90s from Grand Forks County.
I wonder if those are assisted living
I
facilities.
wonder too. They're not reporting who's died.
Can
they
you
have,
get information about
No,
from
no.
each facility, like how
North
many?
Dakota does have a way of seeing numbers, but they're not really showing where the deaths are.
So you can't just look up like this facility has this many, or
Right, you can see the facilities, how many cases they have. Yeah,
how many deaths?
not deaths.
Not
No,
deaths.
I haven't been able to find it, folks. If you can find that on a North Dakota websites,
Well, don't you
let me
think
know.
that would be useful to know how many of the deaths in the state
They
are
don't-
coming from
I
nursing
don't- they don't
homes?
want they don't want to tell you where the deaths are. I don't know why. Now, if you look at the positive cases that reported today, which were actually yesterday cases, again, Cass County 43, and
Wow.
it's and the total numbers is total positive 1,323. Now, this thing that says new on it 2.6 daily positive rate completed tests. That's
Yeah.
a measurement of the tests compared to the positives. And they are boasting, this is why they opened up North Dakota, because this number is so low, 2.6 daily positive rate of completed tests. Fargo is almost 10%. So when it comes to Fargo, Cass County, it's 10%. And they're like, why is that so high? and it's because that's where most of the people are, and a lot of people are catching this, and they've quit putting a lot of the stuff on there that wasn't from community spread, and now they're changing these numbers. I don't know why, and you're seeing it in the national numbers. The numbers have been being tweaked differently and have been interpreted to mean different things. My point of view is that 43 people got sick, and like 8 or 9 of them died yesterday. That doesn't sound to me like anything's going down. And this idea that the state had to show a 14-day, downward trend in numbers and all this stuff, it's not happening. It's going up, and it's accelerated even faster.
Well, the president and press secretary. Everybody's been asked about numbers increasing, and they kind of expected this would happen. And of course, we still can't come to a consensus about whether or not people have to wear or should wear masks, which is problematic. Here's a post. I've been monitoring the social media feed. Somebody posted about their experience going out and whether or not people were wearing masks. The Casey's, which is basically a convenience store, gas station.
Gas station, convenience store, yep.
In case people don't know what that is. But Casey's cashier had a mask covering her mouth, but not her nose. I've seen a few people wearing masks wrong. Clearly, we need instructional videos. And yes, I got my sweet Dragonfly handmade mask from a Good Samaritan, and I wore it correctly. So, do you think it's because people need instructional videos? People have no idea how to wear a mask? I mean, I'm sure that's true for some people, but you think that's really why people are not wearing their mask correctly?
No.
What do you think?
I think people don't want to wear them for a couple of reasons. They're uncomfortable, especially a really good one, a really good mask, like a N95 mask. Very uncomfortable. You're breathing your air back in. It gets hot. It's getting warmer outside. If you're moving around, you sweat more. If you have glasses, they fog up.
Just imagine what it's like for a doctor or a nurse has to wear that
all day long. Shift. And it's like the whole shift, and it's like, so that's one reason. Another reason is there's a huge amount of pressure that you're not cool, that you look silly. I mean, it is minimal as that is, and juvenile as that is, it's very strong with the peer pressure to be cool, to be like, and also to pretend everything's normal, that you're overreacting. I think that has a lot.
You're being a wuss, basically?
Yeah, pretty much. And people not wearing the mask right now, it means they're not taking it seriously. They're not trying to protect themselves, which when I put a mask on, I go, I don't want any spot for anything to get in. It's like you're scuba diving and you want everything to work so you don't drown.
Wow. I mean, it makes sense. I thought that was something that only afflicted teenagers.
Yeah.
But I guess we're all susceptible to it.
Mm-hmm.
And it just seems so silly that somebody's comment about, oh, you're going to wear a mask would make people, grown men, feel peer pressure to the point where they would put themselves at risk or other people at risk. I don't get it. And by the way, as I said, we keep learning about this virus. There are terrifying new symptoms of this virus appearing in children.
Oh, boy.
That are having a reaction very similar to a viral infection reaction, with rashes all over their skin, pink eye in their eyes.
Oh, boy.
And in some cases, cardiac arrest.
Wow.
Yeah. This is coming from NBC News, New York. More and more local hospitals are sounding the alarm on this. It's not rampant throughout children. Children are the ones seeing the least symptoms and severe conditions related to COVID-19. But there is a small group of children that are beginning to present with these troubling conditions. In a statement, Dr. George Ofori, Pediatric Clinical Care Director at the Mount Sinai Kravis Children's Hospital, said some of the cases that we're currently treating entered our care presenting with symptoms such as abdominal pain, vomiting, diarrhea, and a low-grade fever. Others presented first with a rash, conjunctivitis, or cracked lips. Whether the underlying condition is COVID-19 or the body's response to COVID-19 is not known at this time. And while it's too early to definitively say what's causing this, we believe it's important to alert the public as to what we are seeing. So that's really scary. Imagine, having your child have some really strange reaction to contracting this. And it's not the normal symptoms, shortness of breath, the dry cough. How would parents even know? Hopefully, parents that are seeing those kinds of symptoms will now be able to direct themselves to a doctor, a pediatrician that can treat them if they do have COVID. In Georgia, there is a sudden precipitous rise. Nearly 1,000 new COVID cases have sprung up just in the last 24 hours.
Wow.
Yep, the cases had surpassed 27,000, with nearly 1,000 new cases reported just in the last 24 hours. So the majority of the state's cases were in the metro Atlanta area. At least 1,147 Georgia residents have now died of COVID-19. And you have to remember, Duke, that Georgia was one of those 4 states that did not meet the requirements for opening up.
Yeah.
One of those states that decided to go ahead and open up despite the phased, reopening recommended by the COVID task force, the president, and health experts. Despite that, the governor of the state of Georgia went ahead and decided to open up without asking or discussing this with the mayor of the largest city where most of the COVID cases are showing up, which is Atlanta.
Yeah. Wow.
I guess we'll continue to see how that pans out. Meanwhile, 3 meat inspectors have now died. About 149 have been diagnosed with COVID-19.
Wow. Is that because they're inspecting meat in the meat packing plants, I assume?
Well, I'll tell you, it's hundreds of federal meat inspectors have been exposed to COVID-19 as the coronavirus outbreak spread to thousands of the workers at the meat processing plants across the country. About 145 field employees were absent from work as of April 28th due to the COVID diagnosis, and another 130 were under self-quarantine due to exposure to the virus. A spokesperson for the U.S. Department of Agriculture's Food and Safety Inspection Service, the federal agency that inspects U.S. food supply, told this to CBS on Monday. One FSIS inspector based out of New York, one from Chicago, and another one from Mississippi have died due to the virus, the American Federation of Government Employees, a union representing food inspectors, said on Tuesday. Paula Schelling, acting president of AFGE Council 45, which represents 6,500 federal food inspectors nationwide, said she gives the USDA Food Safety and Inspection Service an F grade for protecting their own employees. Every day there are inspectors that are going into facilities where there are known positive COVID-19 cases. People are still going in there and doing inspection. The United Food and Commercial Workers Union said in a statement last week that at least 20 meatpacking and food processing workers have been killed by COVID-19 and 22 meatpacking plants in the United States have closed at some point in the last 2 months during the outbreak. At least 5,000 meatpacking workers as well as 1,500 food processing workers have tested positive and or are awaiting a test result and in quarantine, according to UFCW. Among the concerns for inspectors is that plants do not have to notify them if someone in the plant has tested positive.
Oh boy.
Inspectors can hear it secondhand at best when they're not notified. FSIS inspectors often work shoulder to shoulder with plant employees while monitoring production lines in environments not conducive to social distancing. It's virtually impossible in these meatpacking plants to practice social distancing, said one senior government affairs representative from the nonprofit Food and Water Watch. Despite the close contact with other workers, the USDA has not provided personal protection equipment to the inspectors. The department is still working to identify PPE needs in the food supply chain. So that's concerning because the inspectors, they're not given PPE to go in, but neither are the workers. And if we're not prioritizing this, I suspect we will continue to see more contagion and more deaths, unfortunately. And in some more concerning news, and this is from an opinion page in Healthline News, COVID-19 will mutate. What does that mean for the development of a vaccine? We know that every virus mutates. It's just part of the life cycle of a virus. Those shifts and changes aren't always a big deal, but this new coronavirus, which is an RNA virus, is a collection of genetic material packed inside of a protein shell. RNA viruses, like flu and the measles, are more prone to changes and mutations compared with DNA viruses such as smallpox, herpes, human papillomavirus. As the new coronavirus SARS-CoV-2 makes its way around the world, there's been an uptick in predictions that the virus will mutate into something deadlier and become an even scarier threat to humanity. Mutations, the world naturally conjures fears of unexpected and freakish changes, researchers wrote into a report published in Nature Microbiology in late February. Ill-informed discussions of mutations thrive during virus outbreaks, they continued, which is exactly what we are seeing with SARS-CoV-2. But mutations aren't necessarily a bad thing. Every virus mutates. It's part of the cycle of the virus. In some cases, those mutations may actually lead to a weaker virus. Usually, though, the changes are so slight that there's no noticeable difference in the disease's transmission and fatality rate.
Oh, boy.
The new coronavirus is mutating, but slowly. So, once the RNA virus makes contact with the host, it starts to make new copies of itself that can go on to infect other cells. RNA viruses like the flu and the measles are more prone to changes and mutations. In the world of RNA viruses, changing is the norm. We expect RNA viruses to change frequently. That's just their nature. A pediatric infectious disease specialist and investigator with the Institute of Molecular Virology at the University of Minnesota stated. SARS-CoV-2 is no exception, and over the past few months, it has begun mutating. But the virus has mutated at a very slow pace, and when it does mutate, the new copies aren't far off from the old virus. So, does this make it more contagious? Early research from scientists at Los Alamos National Laboratory show SARS-CoV-2 has mutated into a new form that may be more contagious. The new strain is responsible for the vast majority of infections reported around the world since mid-March. In total, the researchers identified 14 strains of COVID-19 and released their findings to help those working on vaccines and treatments. That being said, the new dominant strain identified does seem to be more infectious in laboratory settings. But scientists are now trying to understand how the variation behaves in the body, which may be different from lab settings. Additionally, the study is in preprint, which means it hasn't been fully peer-reviewed. What do you think, Duke?
Means it's not official yet.
Right, it's not.
That's scary. I've watched too many scary movies because mutants, mutating. It's a scary word. It's a changing. That the virus would change, and that they're trying to figure out how to create a serum, and with it mutating, it's like it reminds me of the flu seasons when you're getting the vaccine for flu from the previous flu, and so you might catch the new flu because they don't have a vaccine for it. And this is worse than the flu. It's not the same as the flu. I mean, there haven't been bodies piling up all over the country from the flu. There's been people dying all over the country, and throughout the whole flu season, but not like this. And this other scary part in that article, it said it's potentially more contagious. I mean, I thought this was very, very contagious. Very, very, look at the way we're living right now. So if it gets worse, oh boy.
Well, according to this article, the mutations likely will not interfere with the effectiveness of a COVID-19 vaccine. In fact,
Oh, that's good.
the slow and mild nature of the mutations is good news for a vaccine, because the virus is still so similar to its initial sequence that there isn't really much reason to think that the difference will matter in terms of the vaccine.
Well,
that's pretty good.
Yeah, that's better.
Hopefully, we will have a vaccine very soon.
Yeah.
In good news for doctors, CBS is reporting there is a new House bill that could forgive student debt for healthcare workers. How do you feel about that?
That'd be great.
House Democrats introduced a bill Tuesday to forget student debt for healthcare workers on the front line of the coronavirus pandemic. If passed, the bill would establish a national forgiveness program for federal and private loans. We owe more than thanks and cheers at 7 p.m. New York Representative Carolyn Maloney, who introduced the bill, said in a press briefing, "We have an obligation to ensure men and women are relieved of the debt that they incurred to train for this critical work."
That's a very good point.
I agree. They shouldn't have to worry about their financial security after this crisis is over. 9 other Democrats have co-sponsored the bill. Under the Student Loan Forgiveness for Frontline Healthcare Workers Act, healthcare workers, including nurses, doctors, medical residents, researchers, interns, and lab workers, would be eligible for debt forgiveness if they had made significant contributions to the COVID-19 response.
There you go.
That's a pretty nice package if they can get it. The one thing I'm concerned about is that there are loan forgiveness programs for certain types of jobs, including teachers.
Yeah.
I know that having worked at the Department of Education for a time, and it was very difficult for people to apply and qualify and meet all the requirements and actually have their loans forgiven.
Yeah.
So hopefully those frontline workers that could be eligible if this bill was passed will not have to jump through those same hoops. Meanwhile, in San Francisco, they are providing medication, alcohol, cannabis, and methadone in some cases to people isolated in leased hotel rooms. This according to MSN News. San Francisco Health Department confirmed on Wednesday that the city was administering alcohol, tobacco, medical cannabis, and other substances in an effort to prevent a handful of homeless people quarantined in city-leased hotels from going outside and seeking the substances themselves.
Good.
You think so? I don't know. There is a mixed response to this. The city-rented hotels have been reserved for individuals who either have COVID-19 or are at a heightened risk of contracting it, and who have no space of their own to safely isolate or quarantine. Some of those individuals have substance abuse issues, and some of them are already on a methadone regimen. The city's health department is doing what it can to help them during the self-isolation period, according to a spokeswoman from the Department of Health. And they believe that they are doing a great service, the people that are quarantining. And so they're doing everything in the city of San Francisco to support them so they don't have to go out, and including making social workers and clinicians available to anybody that wants to begin addiction treatment while in quarantine. By the way, no taxpayer money is being used to administer the substances to the hotel guests.
All right.
Only private donations. There's about 270 people in city-leased hotel rooms who are awaiting self-isolation or quarantine periods. Those receiving substances from the health department. Did you ever think I'd tell you that the health department was passing out marijuana, alcohol, and methadone to homeless people?
No.
No. So, but and by the way, alcohol abuse, which is widespread among the city's homeless population, due in part to easy availability, is a big concern. For those guests, the DPH medical staff are circulating the minimum medically appropriate amount of alcohol, given that you can die from alcohol withdrawal.
Yeah.
But one drug counselor in San Francisco is really having problems with this. Quote, I have it from a pretty reliable source that weed and booze are being given to people in the hotels, and I have a real problem with that, said Thomas Wolf, a case manager who works with addicts in San Francisco. There's an ethical issue here. Alcohol kills more people than any other drug, and I understand the risks of having people detox in hotel rooms, but my understanding is the people who are quarantined in the hotels can leave for 30 minutes for essential services. So if they have to get what they need, then they should do that. But don't deliver it to them, he said. He also pointed out that while marijuana is legal in California, it is illegal under federal law, which might put the Federal Emergency Management Agency funding for some of the hotel costs in jeopardy. We want them to stay inside, but man, you've got to draw the line somewhere and ask for more accountability. Said Wolf, who was a homeless addict himself before cleaning up years ago and becoming a counselor. Don't enable people, said Wolf. What do you think?
That's a good point.
I mean, I think both of these points are very important.
Yeah.
I'd love to hear what my audience thinks of this. Handing out marijuana and booze good by the Department of Health or bad? What are your thoughts?
Think? Yeah.
I'd love to hear what you think. What do you think, Duke?
Well, I can see both sides. The whole enabling thing, the path to recovery is to really not be giving people the drugs they're addicted to. I mean, it's part of you have to be trained to get off the stuff. It's painful and it's uncomfortable, and you're going to go through really hard times. But that's part of the process that exists. So I can really understand his point, that counselor's point. Plus, he went through it himself, But at the same time, we're in different times. This is totally different, and we're going to fight with someone about their addictions while people are dying around them, and they're putting themselves in risks of spreading this disease or getting it themselves when they could just stay home because they got what they need there. So I kind of can see both sides of it.
Well, here are some comments from our listeners and viewers. One cat says, paying for it is the issue. New drug pushers, and some drugs can cause problems in the physical buildings. Sharon Lee comments, since you can die from alcohol withdrawal, this is actually a smart thing to prevent even more hospital admissions. Pot isn't hurting anyone. And, sorry, and I don't even know where Omega Man says alien abductions dropped to 0. They don't want to catch the virus. It can only increase the N95 is a government efficiency rating. That means the mask blocks out 95% of particles that are 0.3 microns in size or larger. N100s have a better seal. Lots of people look better in a mask. It seems to be able to attract any organ they were probably weakened by the Deep Horizon oil spill. 30 strains now. It's nanotech. It's a bioweapon probably designed to mutate. Look up Charles Lieber, Dr. Francis Boyle. Wow, that's a lot.
Yeah, no kidding.
It's not forgiveness. They just bill the government, is another comment. Can I get a martini? They got a waitress walking around Hotel California. You may never leave.
Exactly.
Good comments. Thanks for your comments. As always, we love to hear from our audience what you have to say about the news. In other news, Trump is planning on ending the virus task force in phase 2 of the response to the coronavirus. Yes, he was asked about this, and so was the new press secretary today. And basically, she said that the president has responded to this numerous times as the country begins to reopen, as we flatten the curve, and as we phase out, phase two, basically. The president will end the task force gradually. Is their job done now? No.
No.
They will continue for the time being, but eventually it will come to an end, just like everything else.
That makes sense.
Let's take a look at these scary death estimates. The president acknowledged that some people are worried about getting sick. Others are reeling from job losses and livelihoods. He also increased his projections for the total U.S. death toll to as many as 100,000, up by as much as 40,000 from what he had suggested just a few weeks ago.
Yeah.
Well, of course, we knew that with reopening, we were going to see the numbers rise. And we're seeing those numbers rise in different states. That is expected, which is why it is all the more important for us to take every possible precaution when we are out in public. Now, I know people don't like talking about this mask issue, but I just have to bring it up because it's one of the tools in our toolbox, okay? There is good news about going outside, which I will save until the end of this broadcast because I think you need a little spoonful of sugar to get all of this COVID information down. But there is a ray of sunshine in the stories. But when you're in an enclosed building where people are, shedding virus through their mouth, through their nose, etc., and there's not air traveling through there, there is a greater risk. And that is why when you cannot social distance, when you are in an enclosed space, when you're going shopping, when you're going to any kind of building that there's a group of people in, that's when it's really most important to wear your masks. And the masks do provide an extra layer of protection. This, according to the Mayo Clinic. In fact, somebody posted this article, which we'll share with our audience so that you guys can go check out what the Mayo Clinic has to say about wearing masks. But this poster said, the Mayo Clinic says to wear a mask in public. Your arguments against this practice are invalid and wrong-headed. The Mayo Clinic knows better about this than you or me. Trust them and do the right thing to protect yourself and others from spreading the plague. Well, it is true. And if you check it out, they break it down by the different kinds of masks, their efficacy, how to wear a face mask, since apparently
people don't know how.
People don't know how to do it. And finally, there are some precautions about masks, which include not to put masks on anyone who has trouble breathing or is unconscious, okay? Because otherwise you might be unable to remove, may be unable to remove the mask without help and suffocate. Do not put masks on children under the age of 2.
All right.
Not recommended. And don't use face masks as a substitute for social distancing.
Oh, okay.
That's a very important point. You got to keep doing that. And I wanted to do some myth busting with you tonight.
All right.
The story that I shared with you on my show yesterday during Cinco de Mayo was about Mexico. I focused on why Mexico's media stories about COVID-19 matter, how the government is covering up some information about hospitals, pop-up clinics, and things like that are happening. And I shared with you a very disturbing video of a family from Ecatepec who, after becoming desperate that they couldn't enter a hospital and find out any information about their relative, they broke into the hospital, went into the morgue area where they were storing bodies in the hospital, and went crazy after they found the body of their family member by the name of Alexis. Now, once this video came out, it became viral. It went all over national media in Mexico and also in the United States, with many people, especially and maybe most importantly, those who consider themselves influencers in some way in the United States, began to spread the story about this incident at this Mexican hospital, saying that the family was claiming the doctors were murdering people with shots, injecting them with something and killing them. And they also said that COVID is not real, that we know that COVID is not real. It doesn't exist. And the people we saw dead in that hospital were murdered by the hospital. They're shooting them with something. And there's people out there that are giving some credence to that, blaming the hospitals and the clinics for keeping information. Well, let me just share with you that here in the United States, things aren't that different. If you go to the hospital right now and you're taking someone there with symptoms of COVID, they're not going to let you in the hospital. They're not going to let you wait in the lobby or constantly be coming outside of the hospital, the nurses, the lab people, the surgeons, the doctors leaving the hospital to come out and go, is Mr. Smith out here? Yeah, your son is doing okay. And they're not going to be able to do that. They just can't. And so we're seeing the same thing happen in Mexico. If you've been following Border Network News with Anthony Agüero and Oscar El Blue Ramirez, they've been doing an excellent job of reporting what's happening outside of the hospitals in Mexico. There's lines of people waiting to get in and be treated, and lines of people waiting to get information about their family members. So this isn't anything really unique. It's happening everywhere. One of the things that you should know about this is that Alexis, according to this Excelsior article, was actually out on bail. This is the gentleman, and this is his mugshot. He was in prison for a theft with aggravated larceny. Basically, he stole while using violence. I don't know if he used some kind of a weapon or a firearm, but he stole with violence. And so he was sentenced to go to prison for 6 years.
Wow.
He held up a convenience store. He was actually given bail. He was eligible for bail and parole. So he got out on parole, and he only lived to enjoy it for about a year and a little bit over a year. Because, as it turns out, he was let out on parole with a ankle bracelet. An ankle and he was supposed to be on home arrest, only allowed to leave to his job and going back home. And he had permission to go to a job where he served as a mechanic. He presented to this hospital with symptoms of kidney failure. He wasn't taken to the hospital merely with some symptoms of COVID. He also had problems of kidney failure. He was admitted to the hospital after several days of waiting, according to his family. 5 days of waiting. A bed opened up. Beds are in short supply in the hospitals, you can imagine, during a pandemic. And then he passed away from COVID while in the hospital. People are very upset, especially in his family, because they claim that he died very quickly. He was fine, that he did not have, that they didn't believe that he could have died that quickly from COVID. Okay. So they didn't believe, and they don't believe that COVID exists. So you have those two problems. But let me clear up some of what has transpired. This is Imagen Noticias clip in Spanish, which I'm going to translate to you, about some of the other details. Here's that clip.
Y sobre el caso del joven Alexis, que causó tanta polémica y enfrentamiento la semana pasada en este hospital, esto fue lo que dijo el doctor.
La insuficiencia renal aguda es una de las problemáticas que se desprenden posterior o durante las fases graves de un proceso infeccioso. Entonces, eso es lo que estaba presentando el paciente.
So the doctor, Dr. Josué López Vázquez, said that he had kidney failure, and that was part of the disease process. So it was part of the disease process of COVID.
Paciente y secundario a este proceso del virus de COVID.
As a comorbidity to COVID.
Hermana de Alexis, el otro joven que, insisto, estuvo junto con sus familiares en ese hospital. Después el joven fue dado por muerto. Esto fue lo que nos dijo su hermana.
Now they're going to talk to his sister, who was also one of the people videotaping, and this is what she had to say.
Sobre lo que están diciendo en medios de que se fue de fiesta y que estaba en la cárcel, ¿es cierto eso?
No, él, de hecho, desde que empezó la cuarentena en marzo, él pues ya ni siquiera salió a trabajar ni nada.
So, what can you tell us about the allegations that your brother was out partying, not social distancing, and that he had gotten out of prison? And then she responded, no. In fact, since March, when they called for a quarantine, he stopped going out. He didn't even go to work anymore.
Él ya estaba en cuarentena.
Pero sí,
porque ya traía su dolor de riñón.
Pero sí estuvo en la cárcel.
Mira, más tarde te doy informe.
And he said, but is it true that he was in prison? And she hesitated for a bit and then said, I will have to respond to that question later.
Bueno, no nos quiso decir, pero la información que se ha publicado es que este joven había estado en la cárcel, salió a finales de marzo, obligado a un arraigo domiciliario y hay varios...
Well, she didn't want to tell us, but the truth is that we have since learned that he was released at the end of March. Actually, he was released at the end of February. And that...
testimonios que apuntan a que estuvo en una fiesta y que después terminó en el hospital con síntomas de COVID. ¿Qué está pasando?
So there are numerous witnesses that can attest that he was out partying and then he came down with COVID symptoms.
En estos instantes, a esta hora de la mañana, y en el Hospital de las Américas en Ecatepec. Rodolfo Dorantes, adelante, ¿cómo estás?
Gracias, qué gusto saludarte. Efectivamente, nos hemos trasladado a este municipio en Ecatepec, donde, como bien lo mencionas, este hospital de las Américas, el cual fue irrumpido precisamente por 15 personas, donde alrededor de 5 trabajadores pues fueron agredidos.
So now they went to the hospital to see what's going on since this incident that occurred. 15 staff members, including guards, medical staff, and doctors, were beaten by this family.
Mencionaste que en este momento pues no tiene mayores problemas. Hay pocas personas, pocos familiares que se encuentran en esta carpa que ha sido habilitada precisamente para que esperen que no les peguen el rayo del sol. Sin embargo, bueno,
it's pretty empty right now. They don't have any problems. As you can see, it's fairly unpopulated here, and they do have a check-in point here under this awning for people to check in.
Pues lo que notamos es que en este lugar, en el interior, hay una camioneta de la Guardia Nacional. Se encuentra también los elementos.
Inside, though, you can see that they do, inside the gates, have personnel from the National Guard.
De la Defensa Nacional que se encuentran en este lugar y bueno, pues están cerradas las puertas de momento, pues no son.
There you see them,
la hora
right inside the gate.
Para los informes, sin embargo, permanecen algunos de ellos muy pendientes de esta situación. Lo cierto, Nacho, es que también, bueno, pues en este lugar permanecen también elementos de la Secretaría de Seguridad Ciudadana.
And there's also municipal police there, as you can see behind him.
Este lugar, precisamente para salvaguardar la integridad
to protect
de las personas que llegan a este
the
lugar,
staff
como de
and the
los
patients
trabajadores de
at the
este
hospital.
hospital, Nacho.
Muy bien, te agradezco muchísimo
And so we then find out that there is physical evidence of the fact, according to Delta News. Let's take a look at the Delta News story.
Right.
The Delta News story shares with us that he was wearing an ankle bracelet because he was in house arrest, and that the ankle bracelet registered that he did not follow the guidelines of where he could and couldn't go, which was just back and forth to work. In fact, he was leaving his home to violate his home arrest repeatedly, on repeated occasions. You can see it right there. En repetidas ocasiones, despite the measures of healthy distance. He wasn't following quarantine. He wasn't following maintaining a distance as he was ordered to do by the authorities during his house arrest. Alexis Arturo was admitted into the hospital Las Americas, the Americas, on the 29th of April at 1800 hours, according to the GPS installed on his ankle bracelet. So they can track exactly when he was admitted to the hospital and all of his movements through that ankle bracelet. The night of May 1st, his family went in by force and they found his body and they learned that he had died of COVID-19. So they looked to find the people that were live streaming. A lot of his family members, including his girlfriend, were all live streaming at the hospital. Many of those videos have since disappeared, but in information captured, they showed his girlfriend did have a party. Take a look at this footage. He wasn't following the rules. This is his girlfriend. On the 5th of April, he went to a party. And there was even mariachis. You see the woman there singing? She was singing. That's a mariachi. You can see the mariachi in the back. Mm-hmm. Those are pictures from the party that was organized by his girlfriend, Chantal Leal. Chantal Leal is the name of the girlfriend that organized this party for him. Here they are pictured together. Shortly thereafter, he began to show symptoms of COVID-19 and was admitted to the hospital. Chantal is one of the people that was live streaming at the hospital and that physically attacked medical personnel inside of the building, as can be seen in this video, including guards. She removed her Facebook page, and now they are looking for all of the people that went into the morgue and touched the bodies with COVID-19. This is the Subsecretary of Health, Hugo Lopez-Gatell, saying, because of their manipulation, they're physically handling COVID-positive bodies, we could have an outbreak. So we need to really find all of these individuals and get them quarantined immediately. Well, guess what, folks? They have not been yet able to locate all of those individuals and get them quarantined. In fact, many of them are, as you saw, removing themselves from social media and going into hiding as this case is being further investigated. And one of the doctors attacked by family members has since contracted COVID-19 and died. This is the doctor in question. He contracted the illness. It is not clear if it was contracted from one of the individuals that attacked him or from his job. But it just so happens that shortly after being attacked by this family that went into the hospital, one of the doctors there died. So definitely this is a very serious case of people not doing the right thing. Not doing the right thing. And I know there's a lot of misinformation out there about this incident. So that's why we're here to bust the myths and get you the correct information. Now, a new story from The Hill, which I'm going to share with you guys so you can check it out. Here's that silver lining you were looking for. Evidence is mounting that going outside is safer when it comes to COVID-19. Health experts are saying that people are significantly less likely to get the coronavirus while they're outside.
Yeah. Yay.
Yeah, a fact that could add momentum to calls for reopening of beaches and parks closed to the COVID-19 pandemic and golf courses. Being outside shouldn't be seen as completely safe. Health experts say people should still continue to avoid crowds and maintain at least 6 feet of distance from others so that they don't get the virus. But experts are increasingly confident in evidence showing that the coronavirus spreads much more readily indoors than it does outdoors, a finding that could help set guidelines and policymaking to figure out ways to end the lockdowns that have shuttered much of the nation's economy. Park benches, as long as they are not cheek to jowl, cycling, these are all good things, said Tom Frieden, the former director of the Centers for Disease Control and Prevention. Enjoy nature. It's good for us and has a very low risk of spreading the virus. So, studies suggest activities held outdoors as temperatures warm pose lower COVID risk than those done in an inside indoor space. Tweeted by Scott Gottlieb to be exact, the former Food and Drug Administration commissioner. As we reopen the country, states should look to ease rules that allow more recreational, religious, and business activities to occur outside. And isn't that great news for the summer?
Oh, yeah.
That'd be fun, like you can have outdoor seating and that would be great. So, folks, I hope that you go out and enjoy nature as the spring has sprung. I know I will. And I want to leave you with this funny COVID-19 check. How is your community doing with handling door handles and wearing masks? This man did a little video to share how people were doing in his community.
Touching the door handles, doing the COVID-19 check here just to make sure that Americans are doing the right thing. Touching the door handles. Touching the door handles. Let's see. It's one person with a mask. Oh, she used her foot. Good for you, lady. That other lady with the mask, she snuck in. This guy's using his foot. He's like, that, I ain't touching that. Door handles. Touching. Social distancing. Touching. Jesus Christ almighty.
What kind of a grade do you give that group of people? Some of them are pretty smart. They need to put those foot pedal things on those because the bar door handles,
with the foot,
there's no other way to get in. Or you're going to have to wear some gloves so you don't get that juju on your hands. Anyway, folks, that's all I have for you tonight here on A Mexican Crossing Lines with your hosts, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM KPPPLP Fargo Moorhead, where we are adding local color to your airwaves. God bless you and good evening.